medical management is actually quite simple when it comes to CRS. And the mainstay treatment is saline plus steroids. Now, some people may give steroids through a steroid spray, but we prefer to get the steroid into the saline wash bottle. And why? The reason we do that is so that not only you can get the benefits of the saline, which washes away the infectious components, the allergic components in your nose, but it also distributes the steroid much, much better. There's plenty of research out there that shows that when you use saline with the steroid inside of it, it actually gets through your sinus cavities much better. So now how do you do it? Well, you get one of those NeilMed sinus rinse bottles, which is clear with a black cap. You grab one of those and you're going to fill it with distilled water or boiled water, which you've let cool down to room temperature. You fill it up to the line, which is about 240 cc's or mils of that water. And what you're going to do is create a normal saline component to it. And that's easily done by taking one of the packages from the NeilMed company and placing it into the bottle. Now, if you want to save a few cents, you can make it yourself. And we have that in the description below. So now that you made normal saline and you're in that bottle, what we ask you to do is add steroid to the wash bottle. And the way we do that, we may prescribe it in a form of a liquid form or a powder form. So whatever we prescribe you, grab that steroid from your pharmacy and place it into the wash bottle. The common drugs that we tend to use is something called Pulmicort, another name we call it is budesonide, and another drug that we tend to use as well is called mometasone. So now you made the saline steroid wash. Now with this magic potion, you're going to do it just as much as we prescribe, but once a day, sometimes twice a day, and sometimes multiple times a day. And that really depends on the degree of inflammation that you have in your nasal cavity. And what you're going to do, essentially, go down at 45 degrees, tilt your head, and aim towards the outside of your eye. So say if it was my left nostril, you're going to aim to the left outside of your eye. If it was my right nostril, you're going to aim to the outside of my right eye. And the little trick I tend to say is the left hand for the right nostril and the right hand for that left nostril. Now, you've irrigated half the bottle in one nostril. What should you expect? Well, usually you expect it to come out the other side of your nostril, but it doesn't happen all the time. And don't be alarmed. Sometimes it comes to the back of your nose. Sometimes it goes outside the front of your nose. It really depends on what's going on in your nasal cavity. But the most important thing is that you do half the bottle on one side and the other part is where you direct it. It's so important that you direct it to the outside of your eye, because if you direct it towards the septum, not only will it not really get into your sinuses, but you may cause bleeding of your nasal septum. So when are the key times to use this? Well, I would say use it all the time. But the other key times is just right after surgery, because right after surgery, not only are you dealing with the inflammation of your baseline chronic sinus disease, but the inflammation that I've caused from the surgery being inside your nose. Well, one thing I mentioned was obviously that septum. So if you hit the septum, you may get some bleeding. But other scenarios that may happen is that you press it too hard. And if you press it too hard, you may get it into your ear. Sometimes you press it too hard and it actually goes up a tube that goes up into your eyes, so you get some watery eyes. Again, in both scenarios, just decrease the way you press on that bottle. Another scenario is that you're using this right after surgery, and you dislodge one of the stents or the packing that's been placed by your surgeon. If that's the scenario, just call your surgeon. Another scenario that may happen after surgery is that you do those washes and you get some puffiness just above or below your eye. Again, in that scenario, just tell your surgeon and they will make some recommendations on how you should proceed with your washes.